Hello everyone, I'm Dr. Arthur Polela from Levi Mwanawasa Hospital and an ambassador for the African Society of Regional Anesthesia. Today we're going to be looking at the Erector Spinae plain block, which is an excellent block for thoracic procedures, for breast procedures, as well as for your trauma patients who come in with rib fractures. So you need your screen to be directly opposite you. You need a linear probe in most cases for lean patients because the thickness of the erector spinae isn't all that thick. For the slightly larger patients, you may need a curvilinear probe because you have more depth with that. For the needle, you need a longer needle depending on the habitus of your patient, but you should get away with 80 millimeter needle. So, assuming that all preliminaries have been done, that your local anesthetic dosages have been calculated, and that you've cleaned the area of interest, you now have to locate the landmark, basically. You look at the lower border of the scapula, palpate it like that. Once you have your lower border of the scapula, you go medially and place your probe about 4 centimeters away from the midline. So the ribs will appear as rounded structures, as you can see on the screen, the top surface of the ribs. As you go up and down, you'll notice that the ribs are arranged in the expected manner. You've got the option of counting from the lower rib to your desired rib of interest, but I like to use the landmark technique. And as you scan more medially, you'll notice that the rounded structure will gradually, first of all, disappear, then you have a flat structure appearing as you slide the probe towards the medial aspects. So let's have a look and see what we get. So again, you see the rounded structure. I will slide the probe more medially and wait for a more curved, more flat appearance. So there you have it. You have a flat transverse process. So that's the transverse process. And right above the transverse process, you have the erector spinae muscles. So your area of interest is the area just underneath the erector spinae muscle, hence the name of the block. So you've got the option of advancing your needle from the caudal end or from the cephalad end. I prefer to introduce my needle from the caudal end. And they say it causes the local to spread more in the more cephalad direction. So yeah, let's just make sure we optimize our image. There you go. You have your transverse processes right there. You introduce your, sorry about that. You introduce your needle about half a centimeter away from the probe at an angle of about 45 degrees, and it will come from the right side of your screen in this case, and you've got two options. Either the bony prominency, which is said to be a safe structure and therefore avoiding puncturing the pleura, but others have found that it's more, you get more efficacy by having the soft tissue landmark, which is just the area right in between successive ribs. So once the needle comes in the lateral aspects, you aim for this area, and you see the local anesthetic spread upwards and downwards as well as a dark structure and separating the erector spinae muscle from the transverse processes below. In this block, you need about, this is a volume block, you need at least 30 mils of your local anesthetic to have a good effect. And yeah, that should be your erector spinae block. Thank you very much.